I am going a little dental, a little myofunctional therapy. The reason for this is because they are connected. Myofunctional therapy works on the muscles of the face, which put forces on the teeth. It can affect our clenching and grinding, the wear on our teeth, and it can affect digestion, which can erode the enamel, and it can affect how the teeth go in position, so orthodontic needs in the future. And so I am sharing this information, not as a dental hygienist, not as a myofunctional therapist, but somebody who is connecting those worlds right now, because many people, they go get their regular cleaning and dental checkup. They're told, okay, you're gonna need braces. We're probably gonna have to take some teeth out, and you're probably not going to have room for your wisdom teeth once you get a little bit older. So we're going to take those out. Okay, so let's now look at the body as a whole. God gave us all of our teeth for a reason. We also have a meridian, which goes through our whole body, which connects certain organs, certain systems to a flow of blood, through a flow of lymph, through a flow of glymph, everything in the body that's connected and sending messages to the brain for proper functioning. If you are growing your jaws too small, that the dentist or orthodontist thinks, let's pull some teeth out to make room and make your teeth look all nice and pretty, like what I did. Not that pretty, it's just pointy, right? They just put whatever teeth they could keep, made them small. I've had 8 teeth taken out, okay? So now let's think. They take out the premolars. Okay, let's do that. What are the premolars connected to? They're connected to the lung and the large intestine. So what is that potentially affecting? Well, if we're not swallowing properly because we have smaller space in our mouth, what if we're actually taking in too much oxygen into our stomach, which is setting off the dysbiosis in the stomach, because the tongue doesn't have as much space to do the proper initial swallow. The way that the body would show symptoms of those teeth being gone is nose issues. Interesting. Deviated septums, the nose that's a bit too big for the face because you didn't have the proper growth to support that nose. Sinus issues. Eye issues. Right? Because if your base of your upper jaw is not wide enough, you're compressing everything, all those nerves in, jaw issues, eye issues, and connective tissue issues. So let me ask anybody out there who has had teeth removed for braces. It's going to be the same ones. It's going to be the 4s in Canadian language, the way that we numerically number things. How many of you who had braces and had those teeth extracted have nose issues, sinus issues, eye issues, or connective tissue issues? I would love to know. Oh, and the GI issues that accompany that. Okay, so first of all, that is one part of the puzzle. Next, you did not form your jaws wide enough to fit the wisdom teeth in. This is an environmental thing that is happening. We're sucking on so many more foods. We're eating soft foods that generally don't even require chewing. So our jaws are not going to be put in the same pressure that they once needed, like chewing on fibrous food, growing bone. Instead, that's resorbing. Our jaws are getting smaller, so we don't have room for the wisdom teeth. Well, what are the wisdom teeth connected to? They're connected to our heart and our small intestine. Okay, so small intestine, same thing with those premolars. You have less room in your mouth. You might not be swallowing properly, so you might not be getting the proper digestion. There may be more to this. I'm not a Chinese medicine doctor, but there may be more to the meridians on why the small intestine is affected. But I want the connection there. I can absolutely tell you the connection to the heart, though. If you have smaller jaws and you have a tongue that's the same size, no matter what size your jaw is, well, guess what? Your tongue is going to block your airway. When you block your airway, you get less oxygen to your cells, less oxygen to the brain, which can cause Alzheimer's issues, brain fog, fatigue, and you get less oxygen to the heart, which is needed when you have blocked airways at nighttime and you all of a sudden lose that oxygen, your body stresses out, starts to pump your heart again because for a second there you stopped breathing, right? That's a lot of stress on the heart. Any muscle in the body without oxygen can only create 2 units of energy. But if you have oxygen in that cell, you can build 32 units of energy. Imagine every cell in the body having 30 more units of energy day and night to work on detoxification, to work on movement, to thoughts, to healing the body, right? We need oxygen. So if those wisdom teeth are gone, you have less space in the back of your mouth for your tongue. So at nighttime, you get less oxygen to your cells, okay? Places in the body that people can feel issues if they've had their wisdom teeth out: the ear, the brain, I've already mentioned that connection with the brain, and the shoulder. So why is that? Well, back here, we have a lot of nerves connected here, okay? So if there's any bit of nerve damage, we can feel it in the ears. If your jaw is not occluding properly because you don't have the right teeth supporting the jaw, well, guess what? It's putting pressure back here against the ears, the shoulders, the vertebrae. They're all connected there. Okay, so that's a lot of information, but you can see why I am so passionate for people to have myofunctional therapy assessments if they have crowded teeth, if they have sleep issues, snoring issues, because their airway is blocked. I want to help children grow a big foundation, grow the sinuses, grow the upper jaw, make room for the bottom teeth to follow the upper teeth and create a nice big smile so they don't need braces, so you do not have to pull organs. A tooth is an organ. It has a blood supply. It has a function, okay? It has a purpose in the body. So it's not too late if you've had teeth extracted, if you're in the point of getting braces, like there is a time where you can get some other intervention to help set you up for a better future, okay? I don't want to see people having future jaw issues, right? I don't want to have people having other issues in relate to sleep apnea and to snoring and Alzheimer's and digestive distress and then full body connective tissue issues, okay? Our tongue is a breathing and an eating muscle. You know, you can only go minutes without oxygen. And if that tongue is part of the apparatus for breathing, it's a pretty darn important muscle to have functioning properly, okay? If you have any questions about this, if you want to comment, if you've had wisdom teeth taken out, do you have issues with your heart, with your small intestine? Are you feeling tinnitus and ear aches and ear pain, brain fog, and you have shoulder issues, okay? I would love to know it. Type in the comments what you think. And if you want to know more and you want to find out maybe, you know, if there's something that you can do now to change where you are now, right? You can prevent the future of ongoing pain and discomfort from the issues that you've had. And if you have children, you can prevent them from experiencing what you're experiencing now by getting a myofunctional assessment. I personally do them virtually and I do them in person. So I would be happy to help guide you in the right direction to see if I can help you. I also have online programs and I have one-on-one programs. There's just so much out there that can make it feasible for you to do a little bit of work for a big, big outcome. Okay. I wish you all the best. I hope this brings some type of enlightenment to you on why you might be dealing with what you're dealing with, or your child is dealing with what they're dealing with, because there are solutions. There are people out there ready and willing to help you on this journey, even if it's not in your current area. People around you may not have had the education regarding this. They might not have the desire to, right? We're all pulled in different directions for different reasons. I happen to be pulled in this direction because I am all of those issues, and my child was born with the sleep apnea issues. So to me, it's dear to my heart to help educate the public on what they can do to improve their life and their family life. So I wish you all the best, and I look forward to hearing your responses.